Hypochondriasis, which is known as an illness anxiety disorder, are among the most difficult and most complex psychiatric disorders to treat in the general medical field.
The development and courses of this disorder is unclear. However, it is thought to be rare in children. In addition, in older individuals, their health concerns are more focused on memory loss. The prevalence of this disorder is also similar in both males and females.
This is the following diagnostic criteria for people with the illness anxiety disorder. As mentioned before, they have the preoccupation of having or acquiring a serious illness while somatic symptoms are not present. The individual also performs excessive health-related behaviors, such as repeatedly checking his or her body for signs of illness. The individual may also exhibit maladaptive avoidance, for example, avoiding doctor appointments and hospitals. The illness preoccupation has to be present for at least 6 months, while the specific illness that is feared may change over that period of time. The illness anxiety disorder is usually specified into 2 categories, the first one being the care-seeking type and the second one being the care avoidance type. Here is a case study of the care-seeking type.
My head hurts. What if I have a brain tumor? Wait, I heard it here and here. Oh wait, I think we're here too. 3 tumors in the brain? Oh my god, I need to see a doctor right now.
What's wrong?
You need to diagnose me again. My
Oh
brain.
my god,
My
Jihoon!
brain.
This is the 5th time you visited me this week.
No.
It's only Tuesday.
No, I think I have a tumor in my brain.
Brain tumor?
3 of them. I need to get CTA, MRI, everything that you can do.
As seen in this video, the student is worrying excessively that he may become seriously ill. People with this illness may have no physical symptoms, however, they may think that they have the symptoms. Likewise, people may believe that normal body sensations or minor symptoms are signs of severe illnesses, even when a thorough medical exam doesn't reveal a serious medical condition. Moving on, the next type is the care avoidance type, and this is what a person with that illness might say.
I've passed my stomach ache for the past 2 weeks. What should I do?
You should probably go visit the doctor. Let's go!
No, wait!
Why
I
not?
can't go to the doctor. What if I have a cancer in my stomach? Then they need to rip open. No, I can't do that. No.
Unlike the first example, this student is afraid of going to the doctor since he's afraid that he will be diagnosed with a severe illness. He is most likely in an ambivalent state in which they are both worried of being diagnosed with an illness, but on the other hand doesn't go visit the doctor. On these types of people, medical care is rarely used.
These are 2 different photos that explain the disorder. The first picture shows a woman wearing a mask while she also holds up
Stethoscope
up her chest. This implies that she is highly anxious of her health and thus often exaggerates her symptoms and turns them into something big. I told you I was sick. This photo is also a nice representation of what a person diagnosed with the illness anxiety disorder will say. People with this disorder are highly likely to think that they are constantly sick, even if nothing really tells them that.
To end this off, illness anxiety disorder is fairly a new disorder, and therefore exact comorbidities are yet to be found. However, it is still clear that this co-occurs with anxiety disorders such as GAD, panic disorder, and OCD. In addition, 2/3 of the people diagnosed with this disorder are likely to have at least one other comorbid major mental disorder. These are some of the famous people that are diagnosed with this illness.
Miss Kid, I'm really hurt. I have to go nurse.
Are you sure?
Yeah.
Okay, go.
Oh, hi. What's the matter?
I think I have a strong fever. Can I have a nap?
Okay, let's take your temperature first.
Here.
38.5? This is absolutely normal. Just go to your class. It might look like as if the
student is faking his pain because he wants to get out of class. However, he might actually be feeling pain due to a disorder called the somatic symptom disorder. This occurs when a person feels extreme anxiety about physical symptoms such as pain or fatigue without any type of physical cause. Now I'll be telling you about the DSM-5 diagnostic criteria for this disorder. So number 1, there needs to be one or more somatic symptoms that are distressing or that result in significant disruption of daily life. Number 2, there needs to be excessive thoughts, feelings, or behaviors related to these somatic symptoms or associated health concerns that are manifested by at least one of the followings. A. Disproportionate and persistent thoughts about the seriousness of one's symptoms. B. Persistently high levels of anxiety about health or symptoms. C. Excessive time and energy devoted to these symptoms or health concerns. Number 3. Although any one somatic symptom may not be continuously present, the state of being symptomatic, which means serving as a symptom or a sign of something undesirable, is persistent, and it typically has to persist for more than 6 months.
There are some factors that contribute in developing this type of disease. The first one is genetic traits such as pain sensitivity, and second one is difficulty dealing with stress, and third one is some people with this disorder may pay extreme attention to various bodily sensations. And last one is they may also make some catastrophic conclusions as they experience symptoms.
I think you have a fever. No, I think I have brain cancer. Haha.
Disorder is same as somatoform disorder. This is characterized by physical symptoms such as pain, paralysis, blindness, without any demonstrated physical cause. So if you see this picture, then you will realize that this patient feel pain even though he doesn't have any disease. So this shows the somatic symptom disorder. And second is the relevant or famous example of someone who is diagnosed. Our example is the Leonardo DiCaprio. He is the really famous actor and he has both OCD and somatic symptom disorder.
Eastergrass Cable Ace Awards? Aquariums full of broken pinball game parts, popped but uneaten Jiffy Pops still in the silver bubble? Sample-size shampoos, detergents, and whiskeys, and...
I hate to say this about the cat lady, but I think she's crazy. She's a hoarder.
To hoard is to collect large amounts of something and keep it in a safe, often secret place. Similarly, hoarding disorder has to do with a persistent difficulty discarding or parting with possessions because of a perceived need to save them, regardless of their actual value. In other words, people diagnosed with hoarding disorder hoard things. These people also experience distress at the thought of getting rid of their items, which leads to a clutter that disrupts their ability to use their living or working spaces. One thing to keep in mind is that hoarding is not the same as collecting. Collectors tend to look for specific items and may organize or display them. On the other hand, people with hoarding disorder often save random items and store them haphazardly.
The DSM diagnostic criteria for hoarding disorders are 1. Persistent difficulty discarding or parting with possessions regardless of their actual value. 2. Difficulty is from a perceived need to save the items and to distress associated with discarding them. 3. The difficulty discarding possessions results in the accumulation of possessions that congest and clutter active living areas and substantially compromises their intended use. If living areas are uncluttered, it is only because of the interventions of third parties. 4. The hoarding causes clinically significant distress to impairment in special, occupational, or other important areas of functioning. 5. The hoarding is not from other medical condition. 6. Not better explained by the symptoms of other mental disorders. A few factors that could cause hoarding disorders are environmental and biological. It is said that if the patients lived through stressful and traumatic life events right when the disorder merely started to develop, it leads to an intensification of the disorder. Also, it has been proven that about 50% of individuals who hoard report having a relative who also hoards. Twin studies indicate that approximately 50% of the variability in hoarding behavior is attributable to addictive genetic factors.
One celebrity who was known to have had a hoarding disorder is Lindsay Lohan. In 2010, she revealed parts of her Los Angeles home, displaying to the audience rooms piled with bundles of clothes and boxes of shoes, most of which were discarded purchases that she no longer touched but had trouble parting from. Another famous case is the mysterious death of the Collier brothers. Their hoarding began in the early 30s when both of their parents passed away. The two had each left a large pile of possessions, and the brothers had brought all of it into their home. In 1947, the Collier brothers were found dead under their pile of junk. Their four-story house was filled with garbage, and it took almost 5 hours for the police to even enter the house. Homer Collier was first found dead on March 21st, and after nearly 3 weeks of cleanup of at least 120 tons of garbage, his brother Langley was found dead just 10 feet away from him.
I am absolutely dumbfounded right now. I'm like blown away. This house needs to be burned down, like demolished. Wow.
So today we're going to talk about dissociative identity disorder, also known as the DID. So what exactly is DID? DID is a rare dissociative disorder in which a person exhibits two or more distinct and alternating personality. It's also formally called as multiple personality disorder, and rarely some people can have up to 200 disorder with such DID. So here is a short video clip of what it's like to have the DID.
What he did to you.
Oh,
now,
no.
I want to hear it from you.
No. No!
Tell me the whole thing. Don't fucking do this. I want you to tell me the truth and do not even think about it. You fucking killed him, didn't you? You did it. You killed him. You're so full of shit. You did it, didn't you? Tell me the truth. Don't lie to me. You little fuck, you did it. You killed him. You son of a bitch. You fucking killed him.
No! What the hell you want from me now? Quit your crying. I can't understand a goddamn word you're saying. You little sissy, you make me sick.
So remember, this is different from the difference you find of your own personality. For example, being quiet when you're alone and loud and talkative when you're with someone else. It's as if a different person is inside your body. You might speak in a different language, or might have a certain accent, or you may have totally different attitudes or gestures.
Now I'll talk about the criteria of DID. The first criteria is the disruption of identity characterized by two or more distinct personality states. Some cultures describe this phenomenon as possession. People with DID often feel out of body, and they feel like they're watching themselves doing something. Additionally, they feel abnormal impulses that they would not feel when normal. The second criteria, people have recurrent gaps in the recall of everyday events. So when DID occurs, people suddenly shift their identity, and they notice that they're doing something, even though they have no memory of doing so. Criteria 3 includes clinically significant distress or impairment in social, occupational, or other areas of functioning. So people with DID, because they change their personality frequently, they cannot work or perform other behaviors. And there are certain cases that they are not considered as DID. This includes imaginary friend. For children, it is normal to have imaginary friend.
So what exactly are the causes of this? The main factor is the environmental factor. For example, one might have experienced sexual abuse as a childhood, also known as molestation, and many don't really remember for those with DID. And the psychoanalytic approach works in terms of the Freud's view. And this is because people use the DID as a defense mechanism against the trauma to suppress such memories, creating another self to prevent suffering. And one thing to note is that no drugs are involved to cause such disorder. So there are some differences between DID and schizophrenia. For example, the DID occurs periodically while the schizophrenia occurs continuously. And the DID, the things are more likely to experience auditory hallucination, while the schizophrenia is more likely to develop the cause and develop visual hallucinations. And for DID, there are many display of psychotic symptoms, while the schizophrenia do usually show the psychotic symptoms. So there are skepticisms whether DID is a real disorder. For example, people mention about the localization of DID in time and space because the number of patients diagnosed with DID has increased geometrically in decades. For example, like in the 1950s, there were only few people with DDID in the US. However, over the decades, the number became significantly high. And people also claim that what if the people with DID are simply faking it to have such disorder? Now, there are some supporting evidences behind such criticism because researchers have found that those who are diagnosed with DID show unnatural symptoms like shift in visual acuity, which means your eyesight changes as your personality switch. And there is also a heightened activity in brain areas associated with the control and inhibition of traumatic memories after the change. And these are the cited sources.
We'll be talking about dissociative amnesia. Dissociative amnesia is one of the dissociative disorders, which are conditions that involve disruptions or breakdowns of memory, awareness, identity, or perception, which DA is related to the loss of consciousness. If individuals are affected by dissociative amnesia, this leaves the person to not be able to remember important personal information, such as their identity, or information about close friends and family members. So for example, in the case of Hannah Up, a young woman and a teacher went missing for 2 weeks after going out for a run. She was found face down in New York Harbor, and according to her, she just felt like she was going out for a run, but then 10 minutes later, she just ended up in the water. So this implied that Hannah Up did not remember anything during those 2 weeks, and according to dissociative amnesia, she most likely just forgot about her own identity and just lived as a different person with a different identity for those 2 weeks. So here's the criteria for dissociative amnesia. So the first one is the inability to recall important autobiographical information, usually of a stressful or traumatic event. The second one is that the symptoms cause significant distress or impairment in social, occupational, or other areas of functioning. This disorder is not attributable to physiological effects of substance or medical condition. And the fourth one is that this disorder is not better explained by dissociative identity disorder, PTSD, acute stress disorder, and etc. So now we'll be talking about dissociative fugue. Dissociative fugue is basically a type of dissociative amnesia, and it's basically the same thing except that dissociative fugue is more related to a person traveling farther away. So for example, if Hannah Up had dissociative fugue instead of dissociative amnesia, she would have traveled from New York City to South Korea and lived there as a new person with a new identity. So in a simple comparison, dissociative amnesia is more related to short term, while dissociative fugue is more related to the long term. So here are famous individuals diagnosed with this disorder. Hannah Up, which she was mentioned earlier, Adam Duritz, an American musician, and Herschel Walker, who was an athlete.
For the risk factors, there could be environmental and biological factors. First of all, single or repeated traumatic experiences, for example, natural disaster, wars, and experiences or memories during the concentration camps could cause dissociative amnesia. Also, there could be biological causes, since studies of dissociation report significant genetic factors in both clinical and non-clinical samples. First of all, it's more common in women than in men, and the frequency of it tends to increase during stressful and traumatic times. The prevalence for dissociative amnesia among adults in a small US community study was 1.8%. Individuals with dissociative amnesia may have symptoms that meet diagnostic criteria for dysthymia, major depressive disorder, adjustment disorder, and other specified or unspecified depressive disorders. And PTSD may also develop, especially when the traumatic antecedents of their amnesia are brought into conscious awareness. Also, individuals with dissociative amnesia have symptoms that meet somatic symptom disorder and conversion disorder. Personality disorder, especially dependent and avoidant and borderline. Illustrated through cognitive therapy, which focus on changing dysfunctional thinking, and it can also be treated by psychotherapy, which encourages communication of conflicts and increases insight into problems.
In this video, we'll be discussing about antisocial personality disorder, also known as ASPD. When we hear the word antisocial, we think of famous serial killers from movies or even real life. And in most cases, you are right, most serial killers have this personality disorder. Then what does it mean to be antisocial? In the DSM-5, the definition of ASPD is a pervasive pattern of disregard for and violation of the rights of others, occurring since the age 15 years, as indicated by 3 or more of the following symptoms. The following symptoms are repeatedly performing acts that are grounds for arrest, deceitfulness, repeated lying, cunning others for profit or pleasure, failure to plan ahead, irritability and aggressiveness, reckless disregard for safety of self or others, consistent irresponsibility, and lack of remorse. However, remember that you cannot diagnose them until the age of 18.
So what are the causes? It can be broken down into two major categories. The first one is biological factors. So genes make vulnerable to antisocial personality disorder, such as having parents with the disorder puts one more at risk. And also, biologically speaking, frontal lobe is not working properly in this case. Frontal lobe for a normal person is supposed to be to perceive others' emotion and to feel them. However, for disordered people, they know it, but they don't actually feel others' emotions. So this is the simple phrase to put antisocial personality disorder. And another factor is environmental factor. So life situations may change its development, such as receiving poor discipline from parents, having negative role models, or having not taught to respect the others. So it really comes down to observational learning that the children might have damaged mirror neurons to mimic wrong behaviors of others. And also there are some risk factors or risk or developing this disorder, such as having abused or neglect during childhood, unstable, violent, or chaotic family life during childhood. These traumatic childhood experiences also could alter and change and develop the disorder environmentally. So famous people there are many famous people. However, two major serial killers are the examples. First of all, Ted Bundy. Ted Bundy was an American serial killer, kidnapper, rapist, burglar, and necrophile who assaulted and murdered numerous young women and girls during the 1970s. He was once addicted to pornographies, and his addiction grew as the years went on. And at some point, the hardcore violent pornography he was watching was not satisfying the addiction. And at some point, these fantasies became a reality. And to get his fix to satisfy his addiction, he needed to actually perform the acts, which is to kill people. And also, there was another killer called BTA killer. He is an American serial killer known as BTK. He gave himself the name BTK for bind, torture, kill. Between 1974 and 1991, Rader killed 10 people in the Wichita, Kansas. So we'll further move on to the videos and examples of these people.
Are you insane? Why did you kill him?
I don't know. I just went out to the road and there was a man, so I just killed it for no reason.
Why are you doing this to me? What? Why are you doing this to me?
This case is about catching a monster.
Ladies and gentlemen, I am that innocent suspect.
You are skating on thin ice, partner.
The media has convicted Ted before he's had his day in court.
I'm gagged, and you're not.
I wonder whether he did it or not.
I'm more popular than Disney World.
Did you do these things?
Absolutely not.
So here's the diagnostic criteria for BPD. It is said that you have to fit into at least 5 or more of these criteria to be diagnosed with BPD. And out of these 9 criteria, the first 2 are the most important ones, the ones that kind of differentiate BPD to other disorders. So the first one is about frantic efforts to avoid real or imagined abandonment. And second, a pattern of unstable and intense interpersonal relationships characterized by an alternating between extremes of idealization and de-evaluation. So the first one, it's exactly as it's written. It's about being scared about being neglected, so you put an effort to avoid that. The second one is about having unstable relationship because it's very extreme. So it's either caring too much and expecting too much, or you just don't value it and neglect it. Some other criteria that's mentioned is unstable self-image, being impulsive, instability in mood, emptiness, and suicidal behaviors. So what exactly is BPD? So here are some images. One thing to remember is that the relationship problems aren't about having with significant others. It could be with any relationship you have, family, friends, coworkers. So here's the exact definition. A pervasive pattern of instability of interpersonal relationships, self-image, and effects, and marked impulsivity that begins by early adulthood and is present in a variety of contexts. So the first few lines, it's very similar to what was written in the criteria, but something that's added on here is that it could begin at early adulthood, so your teenage years. Here are some similar disorders that you could confuse with maybe. So first one, bipolar disorder. People could confuse with bipolar disorder because it's said that your mood changes very quickly, but in BPD the mood changes are very quick and very often, so it could change from a minute to another minute. But I believe bipolar disorder is very infrequent compared to that. It's like on a weekly basis more. And depression, just by looking at the criteria of like low self-esteem and suicidal acts, feeling empty, you may confuse it with depression. However, if you look at the depression, major depression disorder, for example, the criteria are actually quite different.
What's up, guys? I'm going to talk about the effects that cause factors that cause borderline effect. One could be child neglection and children who grows up with alcoholics. The second one could be different types of abuses that are experienced by the people, such as child abuse or sexual abuse. And these 2 factors are related with environmental factor in general. Another factor will be about how people feel anxiety about provoking choices, when they feel conflicts about sexual orientation and competing social pressures to decide on careers. This is related to emotional instability. And lastly, it's about biological factors. There are 2 of them. there are I picked two out of the many. One will be how there's a 2/3 chance of you getting the disease BDP if your twin brother or sister has the BDP disease. Another factor will be that your three brain parts are smaller than normal people. They are hippocampus, amygdala, and frontal cortex. So now I'm going to talk about a famous celebrity called Susan Kaysen. She wrote the book. She also faced the BDP disorder, and she wrote the book called Girl Interrupted and the movie. And it's going to be about her life. So there are 5 criteria which told her from the DSM-5 that told her that she had this disease, and now I'm going to talk about 2 of them. So the first criteria was that she wanted love. She wanted to find relationship, make new relationship. So we could say that she felt unsecure relationship. So she had unsafe sex with teachers and even gay people. She wanted to be loved by people. The next criteria has to be related with this. I don't know who I am. In this case, the criteria 2 would be how Susanna wasn't convinced. She described herself as being ambivalent. She doesn't care about her life. Thank you guys. I hope you liked the video.
The general concept of narcissistic personality disorder comes from the story of Narcissus from the Roman and Greek mythology. It tells a story of a hunter who was little too obsessed with their own image. He was looking for the love of his own life. However, after rejecting a mountain nymph called Echo, he saw his reflection in a pond. He then fell in love with his own reflection and unable to separate himself away. Then he drowned. But that is only a part of it. Narcissistic personality disorder is a pattern of grandiosity, need for admiration, and lack of empathy. People diagnosed with this disorder are frequently described as arrogant, self-centered, manipulative, and demanding, as they think they're superior or special. The vulnerability in self-esteem makes individuals with narcissistic personality disorder very sensitive to injury from criticism or defeat.
He has done such a lousy job as president.
50 to 75% of the people diagnosed with this disorder are male. This disorder appears by early adulthood and present in a variety of contexts. The traits are most common in adolescents. Prevalence estimates the range of narcissistic personality disorder from 0% to 6.2% in community samples. Today, we're going to meet a psychologist talking about a famous person who is considered to be diagnosed with narcissistic personality disorder. Adolf Hitler, one of the cruelest leaders of the 20th century, led a campaign that showed the death of millions of innocent people. So, why is Hitler considered a man who is diagnosed with narcissistic personality disorder?
Well, there are many politicians or celebrities who display narcissism and grandiosity. Adolf Hitler's personality disorder is only an assumption because there are no actual evidence that proves he was diagnosed with narcissistic personality disorder. However, Hitler's actions were typical of those who are self-obsessed narcissists, as he showed no empathy for the suffering of other people and believed that all white German race were superior than the others.
Thank you.
Thank you.
So, how exactly are people with narcissistic personality disorder diagnosed? According to the DSM-5, to be diagnosed, the person in question 1. Has a grandiose sense of self-importance. 2. Is preoccupied with fantasies. 3. Believes that he or she is special and unique and can be only understood by similar to those. 4. Requires excessive admiration. 5. Has a sense of entitlement. 6. Is interpersonality exploitive. 7. Lacks empathy. 8 is often envious of others. 9 shows arrogant, haughty behaviors. One thing to keep in mind that NPD diagnosis is only reserved for adults because younger tend to care more about themselves and their self-image. And it might be really easy to mislabel someone as having narcissistic personality disorder, but one thing to keep in mind is that, like we have mentioned before, only about 6% in general population gets it. So how do people get such a rare disorder? Twin studies have shown that NPD is highly heritable disorder, so one factor can come from genetics. However, studies are still being done to figure out which genes are actually responsible for NPD. Other factors also include style of parenting. If the parents treat their kids like an entitled person, it can lead to NPD. One other form of parenting would be very exploitative or unreliable or unresponsive parenting.
Autism, or autism spectrum disorder, can be characterized by a difficulty in social interaction and restricted patterns of behavior. The Korean movie 증인 deals with this disorder. You can assume that the student shown here is diagnosed with autism.
자기 세계 안에 있는 아이랑 소통하기가 힘들 거예요.
김지우 학생 맞지? 나는 변호사 아저씨야.
알파고 시대의 변호사는 10년 후 사라질 직업 702개 중에 하나예요.
그래?
Now that you've roughly got the idea of what is autism, let's move into its diagnostic criteria. According to DSM-5, there are 5 main criteria, but the first 2 are the most important ones. Number 1. There is a deficit in social communications and social interactions. This can be shown through a poor language communication and poor body language. People with autism also show a deficit in social emotional reciprocity. This means that they have a hard time sharing emotions with others. Number 2. Repetitive patterns of behavior and interest is another characteristic. They have a highly restricted interest, which is why people with autism are often described as living in their own world. Also, they are hyperreactive to sensory inputs. Number 3, 4, and 5 are not so important, so just have a brief idea about them. Symptoms must be present in the early developmental period. However, autism may not be visible until the person is put into a social situation or the person may have learned how to hide their symptoms. Symptoms must cause an impairment in the person's ability to hold a normal life. Symptoms shouldn't be better explained by intellectual disability. That's it for the diagnostic criteria. Now, what are some factors that contribute to this disorder? There are some factors that contribute to autism. Genetic and environmental triggers. Autism is known to run in families. For example, it is likely that younger siblings of a child that has autism will also be diagnosed with autism. However, very few conditions are caused only by genes. Nurture is important. For example, researchers found out that being exposed to alcohol or certain medicines in the womb increased the possibility of developing autism. Although people diagnosed with autism struggle a lot when it comes to social interactions, about 10% of them are known to have genius skills, especially in the artistic field. The famous Italian Renaissance artist Michelangelo, Mozart, and Albert Einstein were all shown symptoms of autism at some point in their life. People with autism show an uneven skill development. In other words, they may have problems in the ability to communicate or relate to others, but at the same time have unusually developed skills in other areas such as drawing, creating music, or solving math problems. Here's a person who is diagnosed with autism but has amazing art skills and memory. His name is Stephen Wiltshire. He has a phenomenal memory and drawing is a form of his speech. After taking a 30-minute helicopter ride, he was able to draw out the cityscape of New York City.
It's done now. So I feel happy and good. I'm very proud of my work.